Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning.
Good morning. Good morning. Is it morning already?
It is morning.
Thought
Beautiful
it was nighttime.
sunrise. As I was driving here, Ina and I, we got to see the sunrise, right, Ina? Yeah. So it was a beautiful sunrise coming here.
Ina always sees beautiful sunrises and everything. It's okay. Even when there's no sunrise, she's a sunrise.
Yeah.
I told her this morning, I said, do you go to the beauty salon before you come here? She says, no, it's yesterday. It's just natural beauty. Can't help it.
So I want, the ladies in the audience to bear with us this half hour. The reason is because in every lady's life, there is some guy out there. There is a brother, there is a son, there is a father or a grandfather or a husband.
Oh, one of them.
Yeah, one of those. Yeah. Or even a neighbor who happened to be a man. And since we are celebrating Father's Day this weekend, I thought it was a good topic to talk about is men's health. And we did this last year for Father's Day. Mm-hmm. And I remember a lot of the guy was brought in by their wives or by the sister or by the sister. And I was interested because a lot of the ladies that listen to the show, they say, I always tell my husband to listen to you, but he never wake up. He's lazy. But I told him it was a great topic. You have to go and get checked. You have to check your prostate. You have to do this. You have to do. So it was very, very good. So I thought, it's a good topic for us to cover, talk about men and their health. And from the time in history, the woman's job was around the house, with the cooking and raising the kid. And the man was the one that go out in the field and bring the food home to support the family. And then food became money, currency, and then bring the money home. And it has remained like that ever since. Except that now women are part of the workforce. And many women are, running their own company, and they are very successful. So when you look at society today, the change have affected men in a negative way, because when women was at home, they would make sure the men go and get checked. But now the women in the workforce, they don't have time to really, it's like now that we both running this race, you have to take care of your track while I take care of mine. And men need to be now more responsible for themselves. To take care of themselves,
I have a question.
To work, all this preventive stuff we speak on the wonderful world of wellness. Women tend to take advantage of it. Very few men do, and I tell you, I saw a guy that came to see me because his wife is in Arizona, and he listened to the show. So he came to see me, and I told him, I say, we have to do your test. No, wait until my wife come back. I said, no, you are due. You are past due for your test. So we look at the old test. He said, just look at my old test. And I said, your good cholesterol is very low. And I told you should start taking your vitamin D, your fish oil.
I take the vitamin D that you told me to take.
Your omega-3 and omega-6 and 9 to start taking that. And I say, are you taking it? He say, well, let me tell you what I'm doing. And the guy, is well off. But this is what he does. He go through the different magazines, and when he get 3 months free or get a month free of this thing, he'll send an application or call the number and give all his personal information, and he gets his. And I say, but you know how much junk you're getting out there? You're becoming a garbage can. Why are you doing that to yourself? What are you going to do with your money when you die? just spend some money and get some good fish,
It's
fish oil,
amazing.
for yourself. And I finally knocked some sense into him.
Do you have it at your office, by the way?
I have it at the
Good.
office, and
That's
I tell
good.
my patient, you can buy it here or can get it outside, but I educate them on what they need to get.
And I know, and it's important that actually you're not going to carry anything that isn't really good. That's
Right.
something you should remember. Before you go on further, I have a question then. Why is it still true now that women always live longer than men? Is it because they do go to the doctor? Is it something in their genes? What is it?
Well, women do take better care of themselves than men. I had a young guy, 32 years old, that came to see me. And he said, for the past 5 years, when I urinate, every so often I see blood, just red blood coming out. And I say, well, and how long does it last? He says, sometime 2-3 days, and then it goes away. And I say, okay. And have you ever been going through an evaluation with a specialist or with your primary care doctor? He said, no, I never spoke to anybody about it. So I say, why are we talking today?
Yeah.
And he said, well, I'm in a relationship. And now I know they're going to notice that I have the blood, my significant other. And I think before they ask me and they want to know what it is, I want to know what it is. I say, really? So it's not for yourself. You just want to know, so in case.
Amazing, isn't it? Amazing.
So we started doing the workup in the young guy. And he said, well, I know it's not my prostate. I'm only 32. I say, who told you that? Say, well, all the things that I read on the internet, they put emphasis that the prostate is really, old people, and it's not. And when the old people get it, it's really the prostate cancer do not cure them. I say, that's all of those things you are saying is true. But when it's on a younger person, it's worse. So I was telling him the story of a patient of mine that was diagnosed with prostate cancer at 38. And by the time they diagnosed it, it was already in the lymph node. So the guy had to get a radical prostatectomy, get the lymph node, take it out. Went through radiation, went through chemotherapy, very aggressive treatment. And the guy is very miserable because after the radiation, it affected the colon. Because, when you get radiation, what you are trying to kill is all the cells that divide. And cancer cells, they divide very rapidly. So radiation tends to hit cancer cells very aggressively because they are always dividing from 1 cell to 2 cells, 2 cells to 4 cells, like so. But the intestine, your colon, and your bladder are also dividing. Every day, every minute of your life, they are dividing and creating new cells. Your skin is always going through divisions of cells. So anything that has cells that is in process of dividing and creating, they tend to get affected by the radiation also.
But excuse me, but why the blood in the urine? That's not normal. Where's the blood coming from, and why is it coming there?
Well, what I explained to my young patient, I told him it could be something very simple, like a artery and a vein that have collided in your bladder or in your penis. They have collided, and because the arterial pressure is higher than the venous pressure, sometimes it bursts and make it bleed. And if it's in the shaft of the penis, when you are not urinating, that lumen shut down, and that pressure usually stop the bleeding until your scar form over. But eventually, it can produce a scar that will decrease the flow of urine. So it's important that we pay attention now that you are young, before it becomes a big problem, because some patients have to live with a catheter for the rest of their life. So we have to attend to that. So when I educated him more than what he searched in the internet, he agreed to go and see my urologist, and I told him, it's not an emergency. We already checked your level for your prostate and everything. But after the prostate, then you have, on top of the prostate, you have the bladder in a man, And in the bladder, in men and women, you can have polyps, like you have polyps in the colon, and we strip out those polyps and send it to the lab to make sure they are not cancerous, they are benign polyps. But when they are cancerous, those polyps, if we don't pick them on time at an early stage, the bladder have to be removed. And you see people that have to live with a piece of their large intestine to recreate the bladder from the large intestine. So, blood...
Wait a minute, I'm hanging on a cliff now. I want to know what happened to this man, don't you? Okay, so
well, we sent it to pregnant. The urologist. No, he had a malformation in the bladder, and the urologist called me and said, thank God you picked this up, because the location of the malformation was such that if it would have gone any further and increases, the whole bladder would have to come out. So he was able to shut down the artery that was feeding to the vein. And likely he won't have any problem with this. But then he said, now we have to, very early on, on the game, we have to do now a colonoscopy on him. Which, 32, we don't do that. So that we look for the same malformation between artery and vein colliding together. And it was interesting because when he came back to me, then I checked on his leg, and he has some vein and artery that are colliding, like little varicose vein for the guy. And the guy is not a big guy, it's not obese, it's a skinny guy. So
gotta watch out for those skinny guys.
For all of them, all men, you need to, go to the doctor. If you see blood, like you said, it's definitely not normal to see it coming through your rectum or through your penis. And if you have any lesion in your body, if you have a tendency to bleed, you have to have a check, because bleeding means that the lesion is being invaded by a lot of blood vessels. And usually blood vessels tend to grow in malignant, in cancerous lesion, not in benign lesion. So a lot of time I get patients that they come with a lesion of the skin, and they say, and I ask them, has it grown in size? No, it's been the same. Has it bled? And they go, yeah, if I scratch it or if I rub it, it will bleed. And I say, okay, we have to biopsy this.
Well, I want you all to know that if you just tuned in, you've missed 15 minutes of a masterful discussion by Dr. Mencia, Dr. Andy Mencia. He's world famous. And here in South Florida, we're lucky to have him. He's recently opened another office. His main office is in Fort Lauderdale on East Commercial Boulevard, 1608. It's right from Holy Cross Hospital. And I'm going to give you a phone number. Get your pencils out. It's Pencil Talk Radio. Then I'm going to talk about his new office in Boynton Beach. It's probably not so new. It's maybe a year now, but it's fantastic. And so he's covering the waterfront, as I say.
Yeah.
His number in Fort Lauderdale is 954-489-1345. Again, that's 954-489-1345. And remember, they are open on Saturdays. When he leaves here, he goes right to work on Saturday because he has so many patients and he knows that some people work. And so if you're listening, it's a very good idea to go there, see him on Saturday. He's raring to go, raring to help people. And if you live in a little further north, the Boynton Beach area, now we have a wonderful, beautiful office. It's the AGI Medical and Dental Centers, and this is off Hagen Ranch Road. Very easy to get to. I'm not going to give you the phone number there. I'm just going to give you the Fort Lauderdale number because I know you get confused with all these numbers. Then they'll tell you about that number and they'll direct you there. 954-489-1345. And before I get back to Dr. Mencia, we don't want to waste time, but I want you to know that there are home visits available, and that is extremely important. It's for homebound people. And for Father's Day, if you are a man, you're a wife who you have a husband at home and he's been sitting around and he's not well, and he can't get, because you can't drive him and he doesn't drive, you can call them and they will definitely arrange to have a home visit. So this is Father's Day as we started off. And what are we going to do for our fathers besides kiss them all over, hug them, love them, make a wonderful dinner, but get them to the doctor? That's the best gift you can get them.
Get them to the doctor and get them to get a copy of their blood test when they get blood tests done. If you have any medical knowledge, it's important that you get a copy with the permission of the patient, of course. You have to, some of my patients, I don't want my daughter or my son to be informed. And we have to respect that, of course. But with the permission, just get a check, because sometimes, and I tell, I teach some of the university, FAU, FIU, Broward University, Nova University. So I tell my students when they are rotating with me that when a person get a blood test done, for example, you get your prostate check, and the normal range go from 1 to 4, right? So let's say your level last year was 1.2, and this year is 3.8. And a doctor might say, well, it's below 4, so therefore I'm not going to worry about it. Or a lot of times you ask the doctor, how's my prostate level? When they look at that number without looking at the range, they say it's normal. In reality, if you're talking about doing what we do in my practice, which is preventive medicine, right? A big jump like that asks for some further questioning. How are you urinating? Is your urinary stream as strong as it was last year, or is it weaker? Because it could be that you are in the verge of developing a prostate cancer, and we can avoid that. We can reverse. There are medication now that you take for a large prostate that drop the number by 50%. So to be preventive, this is something that, that can be done. And I just had a patient, a young guy, 72 years old. He owned a armored car company, and he works, Dubai, Australia, all over. And he comes every year and get checked. And I told him, just 72 years, whenever you have time that you're not traveling, do come more often. But he's so busy, and we did the blood test on him just recently, and his liver function was quite elevated, 3 or 4 times the normal what he was last year. So I asked him, do you start drinking or what's going on? And he said, no, doctor, I drink the same thing. I drink wine, and I have 1 to 2 glasses, maybe 3, And I said, okay, any sexual intercourse beside your wife, anything you've been doing during your travel? He said, no. So I said, okay, let's do a sexually transmitted panel to look, because he travels a lot, and I don't know if he's comfortable enough telling me the truth or not. And let's do a tumor marker for liver cancer. And unfortunately, the tumor marker for liver cancer came 15 times the normal range. So, I feel that people over the age of 50 should get checked a little bit more often than once a year. And younger patients below the age of 50, whenever you feel anything, just get checked. Don't let it go. Like this guy with the bleeding for almost 5 years. You let it go. It could be something benign, but it could be something malignant that you can win the battle. And the only way you win the battle with breast cancer, by the way, men can get breast cancer also, just like women, less frequent, but they get it. I have, in my lifetime, I have diagnosed about 6 breast cancer, and one of the 6 had it on both breasts. So
when you are examining them, can you tell that they have any?
Yeah,
are their breasts enlarged?
They feel that little lump and they let it go. And the guy with the double breast cancer, he felt a lump on one side, and he let it go. But he started checking the other one. The other one was normal. Then suddenly he felt another lump. So he asked a friend of his that was retired and say, "Oh, probably it's a fat accumulation that you have there." So the wife say, "Heck no, let's go and see the doctor."
It's the wife again.
Yeah, let's go and see the doctor. So we did an ultrasound right on the spot. Patient was there. We did an ultrasound. I called the surgeon. I said, this guy most likely has bilateral breast cancer. So I'm going to send him over, and I'm going to put him in the hospital. And I want you to do the biopsy. And if necessary, we'll do the surgery right then and there. So we did the biopsy. They checked right on the spot. When you are on surgery, at the hospital, you can check on the spot and say, yeah, it's cancerous. So then they did a radical mastectomy on him. The lymph nodes were not taken. So, he was lucky. Of course, he had to undergo radiation and all that, but he survived the breast cancer. So men can get breast cancer. So, and I exercise, and I'm always, looking at my skin, looking at my body. And from time to time, a man want to also, not like a woman every month, check their breast, but from time to time, you want to check your breast tissue. And if you feel anything that is not your rib cage, you feel like a lump that sits on top of your rib cage, it's very simple. It's a simple ultrasound that we do. And we are able to see if it's fat accumulation, if it's part of your breast tissue, or if it's abnormal. But men do get breast cancer, and they should, check their breast.
And the other thing I think
don't do it in a public bathroom because people are going to think you're weird.
But I think that's really, we haven't touched on it yet, but diabetes with men. Of course, we haven't really gone in. We only have about 2 minutes and 3 minutes.
Yeah.
But what you're saying is come to the office. Let me do some of the tests. It takes a minute. And Dr. Mencia is so friendly, and he has great staff. And just to get the tests, it's so simple, isn't it?
It is very simple. I saw a young black guy yesterday, very entrepreneur. He worked with coconut oil, and he, had his own company. And when he came, and he's in the sun all the time. Coconut oil, he processes his own stuff. So he said, I'm in the sun all the time. His vitamin D level was super low, was in the teens. And I said, my God, do you drink milk or anything like that? He said, no, I don't like milk. I like coconut.
He likes coconut.
I say, well, something? You need something that is fertilized with vitamin D, but at this level, we have to fill up the tank. So I want you to get the same vitamin D you got.
Yes.
I want you to get a bottle of that vitamin D, take it for 3 months, and we'll recheck the level.
Oh, wait a minute.
Now,
I haven't
this
come
is a
back
young
to
guy.
have mine checked, rechecked.
You
Should
want to have a recheck,
I have to have a recheck?
Yeah,
Why?
yeah.
Wait.
Because
before you go to him.
Because we want to see what the level is.
Well, what if it's up? I shouldn't take it anymore? Is it dangerous to take it?
No. You can continue to take it. Yeah, no, you can continue to take it, but you want to know what the level is.
You want to know if the level's gone up.
The level has gone up, right? Absolutely.
Oh, okay, I got to come back.
So I asked this guy about his family history of osteoporosis. And he said, my father, going to the bathroom with constipation, broke his back, pushing down. Just pushing down, broke his so young. And his mother, in her late 60s, also broke a hip. So both have a very early osteoporosis. So I was so proud of myself to check vitamin D in this young guy, which I check on everybody. So proud because I say, I have found what was producing the damage on your family. It's vitamin D. Have your whole siblings, all of them, have them check their level.
And I have to say, the vitamin D is something like $10. It's ridiculous.
Nothing. $10
no
3
money.
months.
And it's a teeny, and it's a teeny little pill.
Yeah.
And I give it to Bill. I mean, he and I
and
both
it's better
take
than
it.
taking Fosamax and all that stuff for osteoporosis.
No. I don't give it to Snowy, our little dog, though. I know this, and I don't. I do give her vitamins, though. Mm-hmm. So happy Father's Day to you, as a matter of fact.
Thank you.
And
to Bill.
Yes, thank you very much. And to all the fathers out there, we certainly were happy. And if you need to see Dr. Mencia today, go down there and have a happy Father's Day gift.
Absolutely.
A gift.
Yeah.
That would be the best gift. So women, get them down there. Then you can take them out to lunch or dinner right afterwards. But you'll enjoy just being with Dr. Mencia, whether anything's wrong or not. He'll be very happy that he went. Thank you, Dr. Mencia. Let me give the phone number one more time.
Thank you, Anita. Thank you, Ina.
954-489-1345. 954-489-1345. And you'll be very happy. The website is agifl.com. That stands for the Adult Geriatric Institute, but it's agifl.com. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.